Good afternoon, everybody. We're going to get started here. Thank y'all so much. You can. Don't be shy. Come on. Mayor's going to come through. Come in front.
In front? Okay. Come on, Vance. With the toll. Let me get right here. I need to get Vance next to me. No, I'm going to say you look good. Hey, I make you look good, Reg. Yeah. Makes you look good. Next to me. You got a milk for Vance? Oh, yeah, we got it.
We do not have a box for Vance.
You know when you have a bunch of chiefs and no Indians. Okay. Yes. Sorry.
All righty. Good afternoon, everybody. My name is Jamie Bujo, Chief Communications Officer for LCG, Mayor-President Boulet's office. Thank y'all for being with us this afternoon. As you can see, there's a lot of excitement in the room as we have a lot of our local municipality police chiefs, our city marshal, and of course, our mayor-president. So I'm going to let Mayor kick us off officially, but I did want to say a big thank you to the town of Doosan for hosting us today, and Mayor Thibodeau, thank you very much. All righty. Mayor-President Boulet.
Thank you, Jamie, and thank you, Mayor Johnny Thibodeau. He drove me around Doosan today to see what's going on, and yeah, there's some stuff happening here. There's a lot of growth, a lot of new homes. It's happening all over the parish, and we talked about that at the State of the Parish, the momentum, the growth, the positive things happening, certainly happening here in Doosan as well. Today, we're here with our law enforcement leaders, our chiefs are behind me, and it's exciting to be with these guys. These are the ones that are on the ground dealing with public safety firsthand from a law enforcement perspective. And so we often work with them, try to find ways to support them, and really try to make sure they have the tools they need, right? I want to thank Kip Judice, Chief Kip Judice. He came to us to talk to us about opioid money and the opioid situation. And interestingly enough to me, he said, you know, in Doosan, we have the highest number of overdoses. I was like, really? Because population-wise, you know, you wouldn't necessarily think that. And he explained to me there's a couple of intersections where sometimes people are dropped off the highway, right? And so they are dealing with things you wouldn't necessarily expect. Would a couple of cameras help? And I think they would. And so what we did was look at the opioid funding we had and allocate $50,000 to each of the departments to tell us what are the tools they need, because they all have different tools at their access, and they're all dealing with the same situation but a little bit differently. And so today we're here to celebrate that and to kick that off. Let me see. I will give you a few little statistics. In 2024, 50 of 67 drug-involved deaths in Lafayette Parish involved opioids, most often fentanyl. I will say this, the fentanyl crisis was really at its height a few years ago. It was really terrible, and I remember sitting in several community meetings learning about it. And I know Dr. Stefanski is here, you know, trying to get a community up to speed on something that was so dangerous and everywhere in places people didn't expect. We all felt kind of helpless, but those numbers have dropped significantly at a statewide level, and as well as here in Lafayette Parish. I think the awareness, the teaching, making people aware, but it is not a non-issue. It is still an issue. It is still something that we're dealing with, just not in those extreme numbers that we had there for a little while. So it is still important that we are working to get rid of it. From 2024, January of 2024 to July of 2025, there were 130 opioid-related deaths parish-wide. 32 of those, 25%, occurred within Doosan's corporate limits alone. Think about that. That's a lot. That's a lot for little Doosan. So we're here. We're here to continue that awareness effort, to continue talking about it, and to continue to support our leaders that are really working hands-on in this area. And so with that, I want to ask the Lafayette Police Chief Paul Chor to come up and say a few words. Let him tell you a little bit about what's going on with Lafayette.
Good afternoon. My name is Paul Chor. I'm the Chief of Police in Lafayette. And first, I want to thank you for the funding on behalf of all the chiefs of police in the area. It will definitely help our community. As you know, there's an opioid issue in this country, and that's also directly related to our community. Just last year alone in the city of Lafayette, we recovered about 1,900 grams of fentanyl just in the city of Lafayette, and hundreds of deaths for overdoses over the last couple of years. So just to give you an idea of what our jurisdiction, the city of Lafayette, is going to use the funding for, number one, we're going to strengthen our Narcan and I can't even say it, we're going to strengthen our Narcan supply. Thank you. I couldn't get it out. We're going to strengthen our Narcan supply that's used for overdoses. This is an inhaler that our officers are trained on, and they can go out on the scene of somebody having an overdose and save lives. Secondly, what we're going to do is we're going to buy a mobile X-ray scanner that we can use on vehicles and cargo vans and boxes and mail to be able to look inside of them to find hidden compartments. So it's a two-pronged approach. One, to save lives of people on the street, and number two, for a tactical advantage to recover drugs before they even hit the street. So that's what we're going to be using just in the city of Lafayette. So thank you.
Thank you, Chief. Next, the Doosan Police Chief, Kip Judice.
Thank you, Madam President. So as the mayor indicated, the highest number of deaths occurring in the town of Doosan parish-wide. And just again, to put in perspective, Doosan represents 0.06% of the total population of Lafayette Parish. We have less than 2,000 people, and there's over 260,000 people in the parish. But 25% of all of the deaths occurred within this jurisdiction. So certainly I recognized a need and a desire to try and get some of this funding. The Parish President's office, her staff was very welcoming, allowed us to apply for this funding, and it made it through the process. And ultimately, we were able, the mayor, Thibodeau, and I were able to meet with the Parish President. And I want to share with you just a couple of things about that. The Mayor-President of Lafayette is on the front lines of spending this money, not only properly, but wisely. She shared with me, and I hope she doesn't mind me sharing her vision for using this money the best way possible and getting a return on her investment with these dollars. And it's really refreshing to watch a political person not take the politics to it, but she wants to look at a crisis center where we do some startup stuff, where a person could either walk in or be brought in that is in crisis, whether it's narcotics or mental crisis or whatever it is. And then she wants to have a private partnership with someone to continue that beyond this opioid funds. So when these opioid funds run out, we have a private partner that's going to continue this forever. That's amazing, Mayor President, and I wanted to thank you for that. And I do want to thank you on behalf of all the chiefs for the grant to help us get additional cameras within the town of Doosan. I do want to share with you that the cameras are not just for historical use. It's not just to after the person is dead that we go find out who brought the drugs to them. These cameras allow us to pre-program known drug dealers' license plates into these cameras. And when they enter a certain zone, our officers will be alerted by way of text message. And so we will know that a threat is occurring. There are two specific locations where we're going to add cameras with these funds. These two locations are responsible for 6 opioid deaths. 2 houses in our municipality who's had 3 at one home and 3 at another one. We're going to stop the 4th one. And like the Mayor President said, it has subsided. I got a call recently from Chief Olivier from Broussard, and he said, "Man, do y'all still have them?" I was actually pulling away from an opioid death, and that's only about 3 weeks ago. A lady had ingested some fentanyl and died at a video poker machine at one of our video poker locations. She was dead at the machine. So yes, we still have that problem, and we do. Even though it's leveled off, I can say this, Mayor President. Looking into the eyes of a mom and telling her son's not coming home, it doesn't matter if it happens 20 times or one time. It's not one of them things we want to have to do again. And so we appreciate you and your vision, your momentum, and we think that we're going to be able to move forward with these funds and get this going in the right direction as well for long term. So thank you again. I appreciate you.
So thank you, Chief Judice. And to give everybody an update on the Crisis Center, this morning, Christina Davies, my Chief of Staff, leads the effort, had a room full of public, private, and philanthropic partners really moving the needle on the direction that we are going to take. And so they spent, I think, about 4 hours this morning really working through it. It was both hospitals, Dr. Stefanski was there. It was all of the key partners in this situation. And what it will do is create a crisis. It's a 23.5-hour not holding center. Today, when somebody is in crisis and they call 911, the police are going to come. And the police are going to bring them to either two places, the hospital or the jail. And neither one are equipped truly for a drug overdose or mental illness breakdown. And so the response is really not ideal, not for the person going through the situation or for our law enforcement, because they have to deal with that. So what this crisis center our stabilization center does, it provides that place for either a family member to bring somebody in crisis or law enforcement to bring somebody in crisis where they can spend 23 and a half hours to calm the situation down and figure out what resources they actually need. And I said it last week at the State of the Parish, the right response can change a life. Bringing somebody in those situations to jail when the jail is full or the jail is not the right environment with the right skill sets to deal with it is not a good solution for anybody. And so hopefully we would take some of the pressure off the jail, we take some of the pressure off of the emergency rooms, and we have a tremendous number of resources in the community, great organizations, great partners, and so we get the right situation to the right resources with this center. So thank you, Christina. And that is kind of our big, long-reaching goal with the opioid funds. Right now, we're sitting on a nice size. So also to support these guys and the work they do is also very important. So with that, I will open it up to questions, if anybody has questions. Yes. Anybody? Yep.
I can talk about mine. The Marshal's office has been tasked to do the parks. We handle all the parks within the city. One of the things that we want to do is we're going to have mobile cameras, 2 mobile cameras that we're able to put in different areas when the parks close, if cars come back there. And we're looking at prevention. And prevention meaning that before you do any drugs, before anything starts or whatever, we'll have those cameras out there, motion cameras, and will let us know who's out there and what's going on. So for our use, we're using them for prevention, and we're going to have 2 mobile cameras that we'll buy in with the funding that we get from the grant.
The city of Scott is doing the same thing as the Marshal. So we will be purchasing one trailer, a camera trailer that will be mobile throughout our city, but predominantly in our park area as well.
Okay. Other questions?
So this is public dollar,
So the opioid settlement, when the state got into the opioid lawsuit, it was a national class action. The state is receiving over the next probably 15 to 18 years cash flow in settlement dollars, and they're being distributed to each parish and each sheriff. And I think it's allocated to each parish. There's a certain amount allocated to each parish. And then the parish government gets 80%, and the sheriff gets 20% of those funds. And so we're talking about the parish share here. So right now we've received 6 million. Over the next few years, I will tell you, I sit on the state opioid commission, and some of the settlements have not been settled out, have not been determined. There are defendants that are still working through what that looks like. And so there will be years where it's more, and it will fluctuate because Walgreens has a different settlement than CVS, than different defendants in the suit. It's a pretty significant amount of money. We don't have it clearly defined as far as how much in each year. Probably it'll take another year or two to settle all of that out, and then you'll have kind of that clear path over time. Over the last 2 to 3 years, Christina, we've collected up to 6 million. Yeah. So it wasn't 6 million this year. It's been about 2 million a year. Yeah. Right. It'll fluctuate a little bit.
And each department gives 50 million.
Correct. We had different people writing applications in for the funding. We weren't really distributing it out like that in grant form, really trying to determine what a crisis center would need, as well as a few other things. But when they came to us with the cameras, Hip Judy's had a really good story to tell. It made sense. And it made sense to let them each kind of decide what is the need in their community and how to use those funds. Okay.
So for,
Not me.
I guess this is for the chief.
Mhm.
So, you heard the chief say that the most important thing would be like cameras. Is that kind of the same thing?
Yes, Karen Crow is also, we're going to expand our camera program that we already have, which has already paid dividends for us in the opioid crisis that we're facing. So we're going to expand our camera program, and hopefully, like the mayor was saying, it takes a parish to work on this together. And if we can prevent it and be on the front end of it, I think we'll all work out the best.
Is there a metric you guys are using for determining success? Is it overdoses stop, arrest made? Is there something you're directly tying it to, or is it kind of, I think I said that there's some tracking.
Yeah. Yeah. We'll let one of the chiefs answer.
I can tell you this, that, so those metrics are really hard, those evidence-based metrics are hard to come by. But certainly, again, with the preventions that we will see with the proactive stuff that we're doing with proactively putting known drug dealers' license plates into the system, and then the detecting, how many times we detect that, is going to be one of the matrices that we look at and say, this is obviously successful. I think with the Marshal system, same thing. Once he realizes how many, because we really don't know, we don't have 24-hour surveillance at our parks, but once he starts recognizing that, and he's got some stuff that he's detecting there, then I think that's where his evidence base. So it's really hard in advance when you have zero to work with in advance. But as you work through the system, I think those matrix will play themselves out. So I think that's the best way to describe it. Yes. Absolutely. You have zero to work with, right? But yeah. But as we go down the line, you'll see those numbers kind of play out.
Yes, I'll give you one anecdote. And Chief Chouard and I were in a conversation once, and there was a big it was an apartment complex they were going in on it, and they watched the drug dealers leave town towards the west, through the camera, the license plate detectors. And so that technology, you're looking at me funny. Do you remember the conversation? Okay, good, because I remember the conversation. The technology really is a game changer when you're dealing with criminal activity that's traveling from Texas to Florida. I mean, we sit in the middle of that. And so knowing, having that technology is a game changer for our guys. No. Further west to the next state, Texas to Florida. You know, that corridor is a dangerous corridor.
They're automated license plate recognition equipped with video. Yes, sir. So it's a dual system that we're going to be purchasing. Yes, sir. I do also, just real quick, Mayor President, if I could, I keep looking over and seeing Dr. Stefanski, and I want to say one of the things that did help us in this community was in this very room, we had an educational event, and we had partners from local hospitals. We had DHS here. We had the coroner's office here. We had families of affected people who had lost their lives or had overdosed, and they gave their testimonies, and it was well attended by my community, and I think that was the beginning of the recognition by our officials here that's saying we want to do that. So I definitely want to recognize Dr. Stefanski for helping us put that together. She was instrumental in getting that going, and that occurred about 2. That's correct. There was a new UL nursing student. Yeah. They had realized the numbers, right? Yes, they had looked at, I think, statistics from Acadian Ambulance for the number of people that were picked up or responses, and then the UL nursing students actually started. But don't let her fool you. She did the heavy lifting, I promise you. So thank you, Dr. Stefanski.
And I'll echo that with Dr. Stefanski, but also with our partners in the media, because public education doesn't happen without you. And when you can see the numbers that we did have and the numbers we have today go down so drastically, it is a community effort. And you guys are just as critical as any one of us, because that is the best way to get the message out, to talk about when something like that is happening. You know, it really was in crisis form. It was happening everywhere, and everybody, you know, not everybody, those of us that don't necessarily do drugs, I guess, we're not so vulnerable, but people, you know, our kids experiment, they do things, and it was really terrible there for a minute. So that public education, so certainly our healthcare partners, including Dr. Stefanski, but also our media partners. Thank you. Thank you for being there with the messages and for telling the stories. And I think we'll wrap up with that.
Yes, so thank you all so much. I know there are all of our media outlets represented today. Appreciate y'all being here, and of course, our chiefs, our Marshal and Mayor-President. If you do have any additional questions or would like to talk one-to-one with anybody, we can conduct interviews in the back. Again, thank you to Mayor Thibodeau, and thank you to Council Member A.B. Rubin of our Lafayette Parish Council for being here today. Really appreciate the continued support, and excited to see that there is a really strong effort to make sure that Lafayette Parish stays safe. So thank y'all so much, and have a good afternoon.